Hello everyone, in this video we discuss about the Alpha Thalassemia. So this is an inherited disorder characterized by a reduced or absent synthesis of alpha globin chains, leading to a spectrum of clinical presentation based on gene deletion severity. Normally, in adult hemoglobin HbA, there are 2 alpha chain and 2 beta chain. In alpha thalassemia, there is absent or reduced synthesis of these alpha chains. So, what is the pathophysiology behind alpha thalassemia? The normal individual possesses 4 alpha globin genes, 2 on each chromosome 16. Alpha thalassemia results from inherited deletions affecting these genes with severity directly proportional to the number of deleted genes. More number of gene deleted will result into the more severe disease. In the molecular mechanism, the gene deletion is the most common cause of alpha thalassemia development. As in beta thalassemia, anemia stems from inadequate hemoglobin synthesis and the excess of unpaired alpha chain. But in alpha thalassemia, there is decreased alpha chain and there are excess of unpaired beta, gamma and delta chains that vary according to the age of the patient. In this diagram, we will discuss about the pathophysiology of the alpha thalassemia. Normally, chromosome 16 have 2 alpha globin gene. So, 1 pair of chromosome 16 result into the total 4 number of alpha globin genes. These 4 alpha globin genes will result into the production of 2 alpha globin chains. Normally, there is balanced or enough production of alpha globin chains and there is formation of HbA when alpha 2 pair with the beta 2 chains. And in healthy blood RBC, there is HbA or adult hemoglobin, which is composed of 2 alpha chain and 2 beta chain. Unlike alpha globin, beta globin is encoded by 2 beta globin genes, and alpha globin chain is encoded by 4 alpha globin genes. So based on the number of deleted alpha globin gene, there are 4 types of alpha thalassemia. First condition is silent carrier, in which only 1 alpha globin gene is deleted. This is a very mild condition, mostly asymptomatic, and there is only near normal hemoglobin production in this condition is seen. The second condition is alpha thalassemia trait or carrier. In this condition, 2 alpha globin gene is deleted. 2 alpha globin gene deleted in alpha thalassemia trait. This is the similar condition as the beta thalassemia minor. Clinically, there is microcytosis on peripheral smear and mild anemia with pale RBCs. Third condition is when 3 alpha globin gene is deleted, is known as hemoglobin H disease or HbH disease. In this condition, severe decrease in the alpha globin chain is there, and due to decreased alpha globin chain, there is excess of beta globin chain. These beta globin chain form tetramer and they destroy the RBC, they damage the RBC membrane and will result into the hemolysis. And these inclusions, beta 4 inclusion in the RBC will result into the phagocytosis of RBC when they travel through the spleen or during the splenic sequestration, and further causes hemolysis and ultimately anemia. The fourth condition, the fourth type of alpha thalassemia is alpha thalassemia major, or also known as hemoglobin Bart's or Hydrops Fetalis. There is no alpha globin production in this condition, as all four alpha globin genes are deleted. All 4 alpha globin genes are deleted in this condition. So there is excess gamma chains, as this gamma pair with the alpha chain and form HbF, a fetal hemoglobin. So in this condition there is no alpha chain, so there are formation of excess gamma or gamma tetramers. Gamma tetramers have very high affinity for the oxygen, so there is no oxygen available for the tissue. This will result into the high output cardiac failure and edema. This condition known as Hydrops Fetalis. Mostly in this condition there is death in utero or there is stillborn cases. So these are the 4 conditions we have discussed based on the number of alpha globin gene deleted. In silent carrier there is 1 alpha globin gene deleted. In alpha thalassemia trait or carrier 2 alpha globin gene deleted. In HbH disease 3 alpha globin gene deleted. And alpha thalassemia major or Hydrops Fetalis, all 4 alpha globin genes are deleted. No alpha globin chain production in the Hydrops Fetalis. As in newborn there is excess gamma globulin, they form gamma 4 tetramers. This condition is seen in Hydrops Fetalis or hemoglobin Bart's. As we know, the main hemoglobin in utero or early life is HbF. HbF is composed of 2 alpha and 2 gamma chains. So if there is no alpha, then excess of gamma is there, and this will result into the formation of gamma tetramers. In the childhood and adult, we know the main hemoglobin is in childhood and adult life is HbA, which is composed of alpha 2 and beta 2 chains. If alpha is decreased, then there is excess of beta, and beta 4 tetramers are seen, which is seen in HbH disease. These free beta and gamma chains have formed stable hemotetramer and causing the less severe hemolysis than the beta thalassemia. As in beta thalassemia there are alpha tetramers, because there is in beta thalassemia beta chain is decreased, so there are alpha tetramers in beta thalassemia. They are slightly more unstable and result into the more RBC membrane damage and more severe hemolysis. Clinical syndrome classification in alpha thalassemia. The clinical presentation and severity of alpha thalassemia are determined by the number of alpha globin gene deleted. Each of the 4 alpha globin genes normally contribute 25% of the total alpha globin chain synthesis. As the number of deleted gene increases, the clinical manifestation progress from asymptomatic to life-threatening condition. These we have already discussed in silent carrier state, only one alpha globin gene deleted. This is mostly an asymptomatic condition. This is the mildest form of alpha thalassemia with minimal clinical impact. Alpha thalassemia trait, 2 alpha globin gene deleted. In this condition is identical to the beta thalassemia minor with microcytosis and having minimal or no anemia. HbA2 level is normal in this condition. HbH disease, in this condition 3 alpha globin gene deleted. This is the most commonly seen in Asian population, and there is markedly reduced alpha chain synthesis. So there is formation of beta tetramer. Beta tetramer seen in the form of golf wall on supravital staining. These inclusion are beta tetramers. As we know, beta globin, as we have discussed, beta globin tetramers have high affinity for the oxygen, so there is less oxygen available for the tissue, and this result into a tissue hypoxia. And these intracellular inclusion of the RBC promote splenic sequestration and phagocytosis. Clinical severity of HbH disease. This is a moderately severe anemia resembling beta thalassemia intermedia or significant. In this condition, there is significant hypoxia with hemolytic components. Now the Hydrops Fetalis. This is the most severe form of the alpha thalassemia. All 4 alpha globin genes gone. In this condition, excess of the gamma globin chain is there, as the HbF is the main hemoglobin of early life, and this gamma chains have a very high affinity for the oxygen, so there is this result into the tissue hypoxia or anoxia, and ultimately result into the hepatosplenomegaly. Most of the cases there is death in utero is the outcome, but with the modern management, intrauterine transfusion now enable survival of the many affected infants, but these need lifelong transfusion dependence, requires regular blood transfusion for survival with associated risk of iron overload and organ damage. The curative option for this condition is hematopoietic stem cell transplantation. Key features for this alpha thalassemia is, as we have discussed, severity of symptoms is directly related with the number of alpha globin gene deleted. HbH disease, when the 3 alpha globin gene is deleted, this will result into the HbH disease. This is similar to the beta thalassemia intermedia. Hydrops is medical emergency. All 4 alpha globin genes are deleted and result into the lethal fetal anemia, intrauterine transfusion and stem cell transfusion offer treatment options. So this is alpha thalassemia for you. Thank you for watching.